Hello, my name is Cindy Abair, and I'm going to be talking to you about the drug promethazine, also known as Phenergan. That is the brand name. So Phenergan is in the drug class of a phenothiazine. The mechanism of action, promethazine blocks dopamine in the chemoreceptive trigger zone, and it also blocks the histamine 1 receptor. Phenergan is used to treat nausea and vomiting. Phenergan has many routes. It can be given intravenously, rectally, orally, and intramuscular. There are several doses depending on what route you're going to give Phenergan. Phenergan tablets come in 12.5, 25, and 50, and the suppositories for rectal use come in that as well. And then the injection forms come in 25 milligrams per milliliter and 50 milligrams per milliliter. If you are giving a Phenergan IM injection, you have to use a deep muscle. Some drug interaction with Phenergan is ketoconazole. Patients should be monitored if they're taking Phenergan long term because Phenergan has been known to cause bone marrow suppression. So patients should have a CBC prior to starting therapy and then frequently throughout their treatment. Some adverse effects with Phenergan include drowsiness, respiratory suppression, urinary retention, also blurred vision, dry eyes. Promethazine is contraindicated in children less than 2 years old. Also, that is because of children being at risk for such high respiratory suppression. Patients should be monitored carefully when taking Phenergan and should take the medication as prescribed. Phenergan has been linked to bone marrow suppression. All right, thank you.